Hey everybody, hope you're well. Now we're going to go into another aspect of medications, psychotropic or psychoactive medications, same thing, which is anxiety medication. Anxiety is very, very common, not only in the United States, but all across the world as we're learning more about it. And anxiety is a complicated emotion. It's complex. The basics of anxiety is about control. When a person doesn't feel in control of themselves and secure, they develop what's called free-floating anxiety. And free-floating anxiety has to do with an anxiety that's running around in the system looking for a context to attach to. So if you've got somebody with, for example, a generalized anxiety disorder, and they say, I'm afraid my kid's going to get run over by a car. And you deal with that, and their kid grows up and goes away, and they're fine. Then they say, I'm afraid of thunderstorms. And then you fix that because they live in an area that doesn't have them. And they say, I'm afraid I'm going to get divorced. I'm afraid I'm going to get sick. It's looking for a context. And there's no rational reason for this. And you can drive yourself crazy trying to solve all these context problems. It's looking for the context. You've got to solve the sense inside that the person doesn't feel secure, doesn't feel some sense of stability. That's why it's about control. They try to control their environment. So the thunderstorms and the kids and the health. And it's because they don't feel in control inside. And there are different kinds of anxiety, as you know, you've been studying with us. There's the generalized type, fear of the unknown, and obsessional fears. There's also panic attacks, which if you've ever had one of those, probably one of the most painful experiences a person can feel when it feels like your heart's going to stop, you're going to die, your heart's going to race until it bursts. It's just awful. There's also phobias, like irrational fears of like flying, being outside, social phobias, this sort of thing. And then there's the anxiety that comes with post-traumatic stress disorder. Well, there's so much good research about these now, and I'm going to go over some of the primary medications that the psychiatrist for your client or the primary physician for your client, I hope it's a psychiatrist because they know more about these particular meds than the primary physician, but sooner or later somebody's got to do it, right? And I'll just go over them and talk a little bit about them because I want you to get some, sort of familiarize yourself with that world. The SSRIs, selective serotonin reuptake inhibitors. These are also used with depression, like Prozac, for example. There's also Paxil and Lexapro. So in other words, the same activity that the SSRIs do about depression is the same one they do about anxiety. If a person is depressed, it helps to put enough substances back in their brain so they don't feel like their mood is too low. If a person has anxiety, it calms them down. It's just the serotonin just makes you feel sort of like baseline okay about the world. So it's the same medication works very well with either depression or anxiety or what we call anxious depression. Some people have both, and SSRIs really help. They take somewhere between, they start kicking in about 4 to 6 weeks after taking. It's not a quick process, and it'll take up to several months to really have full force. So you got to help them be patient with it. Then there are the SNRIs, which are also used in depression. Serotonin norepinephrine reuptake inhibitor. Effexor is the big one. Same thing again, 4 to 6 weeks to kick in, several months to really have the full effect. Then there's the benzos, the famous benzodiazepines, like clonazepam, which Klonopin is the most famous one. Klonopin is a very effective anti-anxiety drug. Xanax and Valium. Now, Xanax and Valium, they're very famous because they're about, you hear people who are upset needing to take it. And the reason they're so popular is because they work in hours. So if someone has got to fly or they've got to have a difficult task or talk, they take a Xanax, take a Valium, and they work much quicker than the 4 to 6 hours. However, there's a downside to the benzos because of tolerance issues. People can be addicted, especially to Valium and Xanax too. They have different levels of developing tolerance, and you don't want to take them for a very long time. They get in, they kick in, they solve the problem, but you've got to get them off of it as well pretty quickly. How do they work? The benzos they boost a substance in the brain called GABA, G-A-B-A, and I want to go into what the acronym means. But you need more of that in your brain. When you don't have enough GABA, you tend to be anxious. So it just puts more of that. It boosts the existence of the GABA that you need, and the person is a lot better off. Then there's pregabalin, or pregabalin, Lyrica, and you've probably seen advertisements for Lyrica. And this decreases the release of some neurotransmitters because there are some neurotransmitters that, as they're released, they increase anxiety. So you got to slow down that some neurotransmitters so the person doesn't feel it, and that's what Lyrica does. Then there's the beta blockers, and if you ever had high blood pressure, hypertension, you know they're pretty well known for helping with that. Heart problems, beta blockers help with, and they're prescribed off-label for anxiety. They're not, you don't see that on the bottle that says will it help with anxiety, but a lot of times with the right psychiatrist or primary physician, it can really help. So that's the idea. Remember, the ground rule is you're not fixing the person with the medication, you're helping them to feel calm enough so they're not panicked, so they can use your attachment, your curiosity, your interpretation, your diagnostics, your suggestions. You're bringing in all the relational needs, and their brain can take it so they can begin to solve the whatever it was, the isolation issue or the fear of conflict issue or whatever, the guilt. They can hear you well enough to solve it. That's why they're important. So hope that's helpful, and we'll see you next time.